Welcome to today's presentation on crew resource management and how it can affect your job in EMS. The objectives today talk about some of the areas in crew resource management, closed-loop communications, and team dynamics, and then present some examples of how they can make your job in EMS easier.
Ladies and gentlemen, we're currently number 1 for departure. We should be rolling in a couple minutes.
Let's do the checklist.
Brakes.
Set.
Windshield heat. It's on.
There are hundreds of small steps for a crew to take to get a passenger jet off the ground. Most of them are covered by checklists.
The checklist is a means by which you ensure that important items are positioned or done properly.
Looks like bags are all in.
Why don't you tell them we're ready to go?
144,000 pounds of passengers and aircraft hurtles down runway 3C. Within 17 seconds, just under 50 feet from the ground, the aircraft begins rolling from side to side. It seems the crew overlooked a very important step. If the crew tried to take off with the flaps retracted, it would be an astonishing blunder. To get the plane off the ground, the flaps on the wings should have been extended to the 11-degree position. But the way the flap handle is damaged suggests the plane's flaps were retracted when it crashed.
If the slats are retracted, and for the most part, with today's modern jets, the airplane is not capable of flight.
It appears the downing of Flight 255 was caused by pilot error. For some reason, a seasoned crew forgot one of the most basic steps involved in getting an airplane off the ground.
Crew resource management came to the EMS world adopted by the aviation community in the 70s and 80s following a slew of avoidable and catastrophic human errors. The relatively new aviation community began to implement a system of strictly regimented checklists, defining of roles, and communication tools that have successfully alleviated many opportunities for human error. And some of these systems, we found, can be integrated into EMS. We all know the signs and symptoms of a patient who's about to crash, but we don't study and prepare for the signs and symptoms of a call that's about to crash. And we've all had them, those calls that just don't go well as we had hoped. Whether it's lack of communication, a poor team dynamic, or a plan that just isn't executed as the leader envisioned. So what can we do to understand and improve our communication, team dynamics, and management of resources to better serve our patients? Well, we can start by learning. The foundation for crew resource management is called closed-loop communication. Closed-loop communication simply focuses on repeating orders and confirming them when they've been carried out.
Rampart, this is Squad 51. How do you read?
Go ahead, 51.
Rampart, we have a male, approximately 60 years old. Heart attack before we arrived. We've started CPR. We've defibrillated once. Request permission to start an IV, esophageal airway.
Affirmative 51, start an IV with D5W, give him 2 amps bicarb and defibrillate again.
10-4 Rampart.
This could be really helpful, not only for informing the lead paramedic or EMT where requests are in the terms of completion, but keeping your thoughts and orders in an auditory format to let other teammates know where a call's going. That keeps the team on the same page.
51, he's still in V-fit. Administer bolus of 100 milligrams lidocaine, then defibrillate again.
10-4 Rampart.
That's closed-loop communication. Everybody knows exactly what's going on, and there's no ambiguity.
Lidocaine in.
Along with encouraging closed-loop communication during procedures and treatment, it's important to foster an environment of open communication. For example, in helicopter EMS, crew and patient safety is the single most important factor to be considered when deciding whether or not to transport a patient by a helicopter. The general rule of safety is on the crew. When there's 1 pilot and 2 medical crew, 3 to go, 1 to say no is the general rule. If 1 flight member is not comfortable with the flight for whatever reason, that flight's canceled. The same thing happens in an environment of open communications on a ground ambulance. Regardless of certification level or experience, any provider has the ability to recognize a potential error and speak up. When you create a structure in which members can voice their concerns without retribution, it's an important factor to patient and crew safety. We want to support team members' ideas. Encourage all members on your team to ask questions while you remain willing to teach. The final phase of discussion in this program is to identify when team dynamics may place us at a disadvantage. When you work in an ad hoc environment, that is, working with a team you've never pulled a shift with before, the teamwork and anticipation that you sometimes take for granted becomes difficult.
Stay clear of patient.
You can combat this by pre-planning during downtime and having open dialogue on responses.
Okay, we're going to intubate the patient with that.
Identify your high-risk procedures and practice your high-risk scenarios. And remember, almost every high-risk intervention can be mitigated by a quick protocol check performed by you or a partner. There's nothing wrong with taking a second to take a look at the checklist or protocol and make sure you're following all the steps. In most EMS systems, responders work with different partners every day. Pre-planning scenarios, like a pit crew resuscitation, can make your job much easier. Practice, assign those roles, and make sure that your partner understands their roles. Now, all of these tools and methods can be helpful, but they don't work without a positive attitude. If you have a positive attitude towards your work, patient, and coworkers, you'll find you've already identified the most important pieces of the puzzle regarding crew dynamics.